Welcome, everyone. This is another and very special episode of the Strength and Knowledge podcast. This is your host, Dr. Josh Funk, and I am very, very happy to bring to you a three-person episode today with myself, Dr. Anthony Iannarino, and Dr. Zachary Baker. Welcome, Ant and Zach.
Josh, thanks for having us on. This one is going to be a very interesting one that I'm excited to get going, especially since we are covering the topic of clinical internships. And we get to do that with actually our first clinical intern that we ever took.
Yes, and I'm glad you mentioned on that. And Zach, I mean, between you and I, starting a clinical education program was something that was always a focal point of what we were going to do at Rehab to Perform when it came to just changing expectations and changing standards from a healthcare profession standpoint. But can you talk a little bit about your clinical education experience and how that has shaped your drive to put together what I feel is a very, very world-class experience for our clinical interns?
Absolutely. And I think you hit the nail on the head earlier saying that the clinical internship is something that we take great pride in. And we always talk about trying to differentiate ourselves and provide value. And I think the clinical education experience that we provide is very, very good and very unique. Going through school, I was fortunate enough to have two different clinical internships in the sports orthopedic world, one in a more corporate setting, but one that had a very good standardized process of getting students in, getting them educated, getting a very traditional orthopedic background. And then the other one that I had was out in Arizona at the Fisher Institute. And I was just blessed to have a very, very good clinical instructor out there, Keisuke Kano, likes to go by K2. And him and the whole group out there, they really took clinical education seriously. The exposure of being in a sports medicine, really like a world-class facility working with collegiate, professional, and Olympic athletes was phenomenal to say the least. Since then, I've gotten the opportunity to help shape what our high school, our undergraduate, and what our DPT clinical internships look like here at Rehab to Perform. And most recently, been fortunate enough to be able to develop and serve as the program director for our newly established sports residency program here at Rehab to Perform.
And this is one of those things where, you know, when you set out to do clin ed, there's a way to kind of half-ass the clinical education side of things. And unfortunately, we still hear about some negative experiences from students that will come through our doors. But one of the things that we've always tried to do is put as much time and energy into delivering a service to the patients or clients that come through the door as equally as possible to our DPT students especially. That is the future of their profession. We view that internship pipeline that Zach mentioned as the path to the profession. So the better experience that we can provide these people, we feel like we're doing a lot with regards to giving back and contributing to the future of the profession. So for us, making sure that clinical excellence is something that not only are we embodying and we're putting that in front of the people that choose us for service, but also for the students who choose us and spend anywhere from, say, 7 to 13 weeks. But Ant, you got to see this firsthand for us. You were our first intern, and you've kind of seen the evolution of the program. Tell us a little bit about just where things have been with regards to the internship program at Rehab to Perform and where you think we've made the most improvements over that time period.
Yeah, absolutely. I think what you said about it being centered on clinical excellence is hits the nail on the head. So when I kind of stumbled into, a small budding clinic up in Frederick, Maryland with just 3 clinicians up there in a 1,000 square foot room, I think what I walked into was 3 clinicians who were extremely passionate about what they were doing. And as a student, you can jump right into that process, and that passion really just infiltrates everything you're doing during the day. And wears on you in a great way to, you have no choice but to be excellent in that setting. So I think what started with, three clinicians who were very hungry and very motivated, worked its way to a little more organized process as we started going through, okay, as we're having more students, what do we want to do with this? How do we want to organize it to make sure that we're ensuring that our curriculum is set, that we are periodizing the experience well enough so that the student isn't overwhelmed, and that we're really setting up students of all kinds of different experiences, whether they've have a background that makes them really conducive to stepping in, or whether they maybe need a little more prerequisites to be ready to practice in the way we are, to set them up for success equally.
And piggybacking on that, I mean, Ant, you're talking about making sure that things are a little bit more predictable, I think, right? So you came in, we learned, somebody after you then came for an internship, and we've kind of been on this gradual evolution of what we're able to provide the students. But if I were just to refer to two books, and it allows me to at least think about this in a parallel of the business service, the operations, E-Myth Revisited and Checklist Manifesto. So this is where we get into these systems and processes that allow us to have an internship program that is delivering on exactly what we set out for it to be. So Zach, you, all right, and this is where I'll give you a ton of credit, have been a critical cog in really taking our Clin Ed program to where it is today. Talk to the listeners a little bit about what you've put in from the structure of it on a macro, and then some things that maybe you're focused on a little bit more right now as you see the future of Clin Ed.
Yeah, and I think you kind of served this up as a good segue with what you and Ant just touched on. When we talk about clinical education, it's all about providing an experience and balancing expectations between the school, the student, the company, and ultimately the patients who are coming in to get serviced by that company as well. So when we create this internship experience, it's a matter of how do we check off all the boxes of what the academic institution is hoping they learn? How do we check off all the boxes of what we at Rehab to Perform think are the newer and more up and coming trends within the field, and what some of the more modern literature and research is showing that maybe the schools haven't had a chance to dive as deeply into? And then how do we get all of that to function within the confines of the logistics of the clinic and still maintaining that high quality, really world-class patient experience? So on a macro level, our students are coming in at various points of their PT curriculum, some in their second year, some in their third year. The duration of the internships range from as little as 7 to 8 weeks to as long as 16 weeks. So the amount of time that we spend on different topics may vary depending on the length of time that they're there, but the sequence of how we do things and the overall material that we cover is consistent with every student that comes in. So I would say on a macro level in that early phase, it's really just acclimating the student to our environment, our processes, and how we do things as a company, getting to know them better. And a lot of this actually takes place on the intake form and the interview process of what kind of student we're getting with regards to their experiences. And over those first couple of weeks, we're trying to just get them immersed within our company and within the patient care feel of things. As they start to get a little bit more comfortable, we then get them introduced into very just low risk patient care situations where maybe the plan of care has already been dictated by the clinician, and we're having the student take them through some very predictable processes from an evaluation or from an intervention standpoint. As we're able to hash out how that student thinks and how they operate, then we start giving them a little bit more freedom with creating plans of care and creating intervention strategies that we review with them prior to implementing on patient care. And as we get further into their process, it's just a matter of providing them more autonomy and providing them more freedom, and ultimately a larger volume of interaction with the patients. And with this, I think all of our clinicians in the clinic do a very good job of putting their own individual spin on it. But we have a curriculum and a guideline that we utilize to make sure that we're covering all the big picture topics and rocks that their school wants them to hit, but also that we feel are most prevalent in the rehab and sports performance world currently.
And I'm going to touch on just something that you brought up, and it is, right, just to provide context for the listeners, but we have students who I think are now coming from over 40 different schools, at least based on the amount of contracts that I've helped set up with Jamie, especially recently. But we have over 40 different universities that we have slightly different contracts with. There's slightly different expectations. The time in which they get to spend with us is all a little bit different. So the framework and some of the guidelines and checklists that Zach and the rest of our team have put together allow us to at least make sure that on a rehab to perform level, those students are getting some of the same expectations that we would expect of our clinicians. And real quick, just for anybody who wants to reach out, wants to be connected to more universities, I went to APTA Next. That is the conference that the APTA runs, where you will have a lot of either students who are in school or new grads, in addition to people from universities. And I interacted with a ton of the people who are in the director of clinical education role. Got a lot of business cards, reached out to a ton of people. Some stuff worked out, some stuff didn't, but I'll go through a period almost every year now where I will reach out more and more to new programs. And fortunately, because of the reputation of our program, we now have had more and more people reach out from all across the country. We've even had somebody from Australia who has spent time, with our clinic after reaching out and initiating some of these contracts actually on their own. So that just provides you a little bit of context in terms of how many people are coming through our doors and how the importance of systems and processes allow you to deliver a very, very similar product. This is especially important when it comes to the student internship that is going to occur at one of our 4 locations right now. So Zach is delivering this in one area up in Frederick County at 2 different locations. He's overseeing the other PTs who are at our offices there who are working with students. And I think, correct me if I'm wrong, we either have 7 or 8 right now, Zach.
I believe, I want to say with this newest week, we just got an extra one in Mount Airy from University of Pittsburgh, which I believe brings the total to 8 across the 4 clinics.
Yep. And then if we have down county, right, we've got Germantown and Bethesda. And Ant, this is where I'm just going to tag you in a little bit. But what do you think has allowed the clinical education experience to maintain the standard in which was set up at Frederick, and ideally be communicated and evolve without a ton of in-person connection between our PTs?
I think the big thing is continuity. And what we've really been fortunate to have is within myself and Mike Reinhardt is 2 people that are coordinating at clinics, myself at Bethesda, Mike at Germantown, who have been through the clinical education system here at Rehab to Perform. So being able to understand that process as a student and then go on and be directing a clinic and then be leading that clinical education process at the clinic, I think helps to, that do it, teach it methodology. On top of that, talking about the curriculum we've set and some of those checklists, I think really helps to keep that standard of care and standard of teaching really high as we, we're opening more clinics and as we're spreading out here. So yeah, continuity and then having those checklists and then that commitment to clinical excellence, like we talked about, as the foundation. And overall, I think the big thing is in something we saw, at some of the apex of this pandemic when a lot of our students were not able to continue or finish out their rotation was it just really, the energy in the clinic is different when we have students around. I think it holds our standard of practice accountable having to teach it. And it just brings a different level of life because we really enjoy teaching. We enjoy having the new, fresh ideas and energy that a student brings. So I think overall that it's such a synergistic and symbiotic process to just level up the entire practice of our clinic.
Yeah, I mean, I definitely agree with you. I think one of the main things that people talked about throughout the pandemic was just that the vibe was different without students, right? They bring a curiosity and they bring an energy. And they typically, quite honestly, especially some of the high school and college students, they're a little bit more entertaining, and they keep the mood just light, right? And it's been very, very nice having the high school and college interns back as well. Or I should say that they're starting up here within the next 2 to 3 weeks. Very, very much looking forward to starting that pipeline again, right? If we're talking about path to the profession, high school and college is actually where things start. So, Zach, I want you to talk a little bit about how now you have peeled back the layers and you've not only made sure that our DPT students are having an amazing experience, but talk about the importance of providing an internship experience for college and high school students and what your recommendations are for including them as a part of our total experience here at Rehab to Perform.
Absolutely. And we have to provide a little context, we have the DPT students who are with us through their physical therapy school as part of their formal curriculum and their clinical affiliations. And then we also have high school students and undergrad college students who come in. Some of it is set up on their own. Some of it is set up formally through their school. But we're fortunate enough here in Frederick and Montgomery County and Carroll County as well, which is surrounding 2 of our locations, where the local public school systems actually have sports medicine programs built into their high school curriculum. So we've made an effort to familiarize ourselves with the local high schools in the area and provided an internship opportunity for students who are in those sports medicine classes to come out to our locations for either the first 2 periods of their day, which is roughly the morning of their school day, or the last 2 periods of their school day, which is basically from lunchtime until school is out. And with them, it's nice because we get them on a daily basis. So they really become a part of the clinic. They're with us for about 4 months, every day from about 2 to 3 hours, which the hardest thing with the high school and the college, they don't have that vested interest, meaning they're not at the end of their career path like a DPT student who can see the light at the end of the tunnel. So with the high school and the undergrad students, it's really a matter of how do we keep them engaged? How do we keep them attentive? How do we keep them in the loop with what's going on in the clinic? Because from a legal standpoint, they're obviously not able to do as many things from a patient care standpoint as the DPT students can. So something that we worked hard to develop was to take all of those concepts that we use with our DPT students from an educational standpoint. So we're talking about things with regards to anatomy and energy systems and exercise programming and sports performance topics. And I don't want to say we're watering it down, but we're presenting it at a more superficial level so that they can have a general understanding of some of the things we're introducing to our patients. And then a cool thing that we get to do is we get our DPT students to then get some private or small group interaction and instruction time where they work with the high school and undergrad students and almost have like a chalk talk or a classroom type session where the students will have some materials that they'll review, they'll come back, meet with the DPT students, and they'll get to provide a little bit more depth and clarity on those subjects. And it really lets the DPT students hone their skills from an educational standpoint and communication standpoints, which you see a direct carryover in patient care as well. So like Ant said, we try to provide, I'm going to steal a word that Josh likes to use, an ecosystem where we have this very synergistic approach where everything from our part-time high school interns to our full-time staff are all working towards a same common goal using a same general framework.
And I'll just add, just for people to understand what we're putting in front of our high school and college students, but it's almost general physical preparation, right? If you think about GPP, we are doing GPP, obviously not from a training and fitness standpoint, but we're generally preparing the high school and college students for a more specialized track later. So if we can generally expose them to healthcare concepts, generally expose them to some of the basic sciences, basic patient interactions, we've had a lot of our high school interns especially end up in a wide variety of different specialties as they've gone throughout their educational experience. The other thing that I will add that I think is also very, very important, and it is twofold here, but your students, especially if you're connecting with the high schools around you, are amazing marketers for your business. They will post, with your permission, appropriate photos and videos of the clinic. They will check in at your office. So for somebody that wants to get a little bit more connected to those high schools, it's probably not a bad idea. It'll get you out in front of the guidance counselors, the teachers. It could even allow you the opportunity to go speak at a career day or potentially speak to, say, one of the sports medicine classes that Zach mentioned. And then, honestly, in a world where we are much more aware of social injustices, equality, equity, when we think about creating healthcare that is ideally more proportionately or a more proportionate representation of our population, it is essential that parts of our high school internship program are reaching some of these schools that are typically less affluent and more inclusive of people of color. And that's something that I feel like we were doing a good job of intentional inclusivity with regards to our internship program prior to some of the events that have gone on this year, but we've even ramped it up another notch with regards to making sure that we're tracking things a little bit more, making sure that we're connecting with some of the high schools in our area that typically have students that don't look like myself, Zach, or Ant, and then also making sure that we're in a situation where some of the universities, say at Hampton University, Howard, Middle Tennessee, VCU, but you're providing a path to the profession for everyone, especially under the awareness that outcomes and trust in the healthcare system can increase with somebody who is a patient working with somebody who looks like themselves. So that has just been something that we've been really deep diving in over the past few months on all different levels, and really just trying to think critically about providing a future. I mean, the number 3% stands out if I'm just talking about Black persons of color with regards to the DPT representation itself. That is significantly less than the representation found within the DPT student body. So if we can get that number to 4, 5, 6, 7, feeling like we have a tremendous opportunity to provide that path to the profession and early exposure, especially in high school, being something that is essential. And you are also somebody that's kind of, and I brought up career days there, and contacts with guidance counselors even. Talk a little bit about those interactions and how you really have, either enjoyed it or it's benefited you or taught you something.
Man, it's been each one is such a unique experience. Like I've been and done, high school, middle school, and grade school career days, and each one throws a little bit something different at you. So first and foremost, just shout out to the teachers in the world who can step in front of a second grade classroom and keep them engaged for more than 5 minutes at a time, because that is a skill in and of itself. So I think really what you elucidated, Josh, was showing a path. And that's what that career day does. I think if you can come in and show them the big picture of what we do as physical therapists, because what I find is I first start off asking some questions just to gauge about what the perception of PT is and what we do. And really, I don't think a lot of people are surprised. A lot of these kids don't really know. They don't really know they have a very superficial understanding of what's available in the profession. So when talking about, how that leads into our internship, it's clearing a path. It's showing what's available. And I think when you talk to anyone who's become a physical therapist, they have this kind of like spark moment of, oh, when I had an injury, I went through physical therapy, or when I met someone who was a physical therapist that showed me what this looked like. I think as much as we can cast a wide net to create opportunities to create a spark moment for kids who may not have exposure to the profession, and may not organically end up there, we can end up with a more of a diverse population, which is going to level up the field. So those creators are pivotal to that. And I think from things I've learned is, number one, kids, a lot of people don't understand the profession. Number two, kids don't understand how a lot of what they're learning in school is going to build on what they can do professionally. So I like to tie in, what they're learning in science class and how that may relate to what we're doing in the medical field. So those are two big things and two big ways that we can, demonstrate and show a path.
Yeah. And I think it is essential that we continue as a profession to look outside of our four walls for that connectivity to the community. That is a central theme of things that we are doing. It is part of our belief that by doing certain things to connect with the community, we become a more transformational environment instead of just transactional. We don't want to just be here when you need a service. We want to make sure that we're a mainstay in the community. And I think that's something that we've definitely done a good job, and we're going to continue to evolve what that looks like and ideally make a greater and greater impact. But fellas, this is it for part one. We're going to come back with a lot more of the micro or the specifics for part two. We are going to dive deep into really some of the onboarding strategies, some of the ways that we structure our schedule, and honestly, some of the things that we have seen that are both positive and negative when it comes to not only the students themselves, but things that as clinicians that we need to make sure that we're doing so that students aren't a negative, but they are a value add. So we will have to get together again at some point this week to bring everybody part two. But for any of the listeners that have questions, do not hesitate to reach out to myself, Ant, or Zach. But that's it for part one, and hopefully you tune in for episode 2.